Tank is a 5-month-old male Tegu reptile that's being seen today for dragging his right forelimb, and there's a swelling on his right forelimb. He seems kind of painful. What we're doing today is giving him an exam from head to tail and looking him over to make sure that there's nothing else going on in conjunction with the swelling of his right forelimb. When we finally get down to looking at his right forelimb, what I can feel is there's a swelling up by his shoulder area, and I feel kind of a crunching sensation. It's called crepitus, and what that tells me is that there's likely a fracture going on. There's also a swelling down near his wrist as well. It feels nice and firm, so it's a little bit difficult to say whether or not it's an old healed fracture or if there's something else going on. What we did was we took x-rays to find out what was going on with the bony structures, and it shows that there is a fracture in the proximal portion of his right humerus, which means up near the shoulder of his humerus bone. And there's also a swelling down near his wrist where the bones just sort of fade away. The bone density has been decreased a lot, and it's suspected that he has some signs of early metabolic bone disease, which is commonly found in reptiles that aren't getting adequate levels of calcium in their diet and also may not be receiving the appropriate amount of UVB rays and UVB lighting. Both of those things are essential to convert that calcium into vitamin D so that they have good, strong bones. I think what might have been going on here was that the UVB lighting may have been filtered out a little bit by the screen on the top of his cage. So that may be contributing to some of those early signs. Luckily, it doesn't appear advanced or to be in all of his bones, so hopefully we can correct that with a little bit of extra calcium added to his diet. As for the fracture, what we need to do is stabilize that fracture to keep it from moving so that it can heal appropriately. We placed a white tape bandage around his upper body to help hold his leg to his body and help to contain and stabilize that fracture. With a little bit of pain medication and some time for healing, that should heal up nice and straight, and he should be able to use that a lot better within a few weeks.